Thurmer. I'm going to be performing my IV start video today following my general principles and safety practices. I would do 2 patient identifiers and assess for allergies. Knock. Hi, my name's Destiny. I'm going to be your nurse today. Do you care if we start an IV on you? The patient says yes. I would provide privacy and do hand hygiene. I started out by setting out my supplies and cleaning the table before. Now I'm going to start by opening up my IV bag. I am checking the expiration date and it is not expired, it is in date. Now I am opening up my IV tubing. Ready? I'm ready. Making sure it's not tangled. Okay, alrighty. Now I'm going to start by spiking my bag. Possibly. Okay. I'm going to take my cap off and throw that away. I'm going to get my bag, take its cap off, and throw that away. Spike my bag. Once my bag is spiked, I would hang it up. And I'm going to prime my tubing. I'm going to fill this halfway. I'm priming my tubing, making sure that there's no air bubbles, and there is not. So I would lock this back and place my cap on. Okay. Now I'm going to hang this up. Now that that's out of the way, I'm going to prime my J-loop. Go up and loose. Make sure there's no air bubbles. Take my cap. Put that back on. Ready. I'm going to put this back in the bag to keep it sterile. Okay. Next, I'm going to palpate for a vein. Okay. Once I have that, I am going to perform hand hygiene and don my gloves. Gonna open up my IV start. get out my tourniquet. I'm going to place this 3 to 4 inches above the IV site. Ready? I'm going to check the radial pulse. Okay, it is good. And now I'm going to clean the site. Alright, I'm going to let that air dry. I'm going to prep my needle. I'm going to go in at a 10 to 15 degree angle, making sure it's bevel up. Okay. Okay. Once I'm in, I am assessing for blood return. There is, so then I would pop the tourniquet, push this down, and inject the needle. Ready? I'm just gonna stabilize this. Some tape. Make sure not to touch anything. Okay. That is good. Alrighty. Now I'm going to get out my J-loop. And I'm going to remove the cap. Connecting this, and adjusting that tape, making sure my patient feels fine. Ready. Then I would pull back for blood return. There's blood return, and then I would flush. I would flush this whole tube. Okay, once that's all the way flushed, I would throw that away. And I would stabilize this with some more tape. Alrighty. Now I'm going to get my Tegaderm. I'm going to place right here. Once I place the Tegaderm, I'm going to label the site according to policy. Okay. Once that is labeled, I am checking the site and it looks good. Now I'm going to get an alcohol swab. Get this prepped. And I'm going to scrub the hub. Okay. Once I've scrubbed that, I get my tubing. Put that on my hand. Okay. Okay. Now that that's in, I would set the flow rate to as ordered. So I would unlock this. I would set it to as ordered. I would label my IV bag and tubing with the date, size, type, and initials. Alrighty. Now I am going to take this over here. I would clean up. I would remove my gloves. I would perform hand hygiene, report and record, and I would come back to evaluate my patient's response to the medication. And I also would check before I left the room for filtration.